Welcome to Startup Health Now, the weekly web show that celebrates the healthcare transformers and change makers, reimagining health. My name is Unity Stoakes, and today we are at the Wearable Tech and Digital Health Conference in San Francisco. We've got an exciting guest, healthcare transformer, Chris Cutter, the CEO and founder of LifeDojo. We're going to be talking about what it's like to build a behavior change company and focus on the corporate wellness market. Stick around, it's going to be a great show.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
So welcome, Chris. It's great to see you here in your hometown.
Yeah.
We're in San Francisco.
Thanks for having me.
So I thought we'd start the conversation by learning about you, learning about LifeDojo,
Sure.
and really what drives you, your mission with LifeDojo.
The mission is pretty simple. My background's in public health, population health, and when you look around the country, the obesity rate, diabetes rate, the stress level rate in adult populations, as well as kids, unfortunately, is in the 30 to 40% range. And that hasn't been always the case in this country, and there's an opportunity to reverse that crisis. And so LifeDojo is about bringing the best of public health to technology so that we can really scale it to hundreds of thousands and eventually millions of people, so we can turn the numbers around on that crisis that we're facing.
So taking a step back in your personal journey, when did you decide to take this observation or your focus on public health and take the leap and become an entrepreneur and do something about it and try to create a solution for the market?
Yeah, it's a great question. So my first 7 years in my career were in New York City in public housing. So it was community development, grassroots efforts to help people improve their health behavior and education as well. And we had great funding from the Federal Department of Education and a lot of private foundations. But when you started to look at the budget of how much per person those programs cost, that's when I realized that we have these huge waiting lists of people that want to participate in these effective evidence-based programs. And other cities were even trying to ask, how do you do this? And all I could say is, go find millions of dollars. And to me, that was a terrible fact that had to be remedied. And so this idea of building a platform, I just got off the call with health coaches at LifeDojo from this morning. 7 people were able to work with 2,000 people in the past 5 days. Just
incredibly scalable.
Session. And so that to me is the opportunity that we're bringing to the table. Yeah.
So, are you U.S. focused? Give us a little context to your global vision, your long-term vision, where things are.
So the opportunity for us as a business is very focused on the Fortune 500.
Okay.
And if a company is self-insured and they have 50,000 plus employees, oftentimes global, and we are in about 16 countries right now, the cost per person for that self-insured rate is very high as the risk factors in the employee base go up. So our job is very simple. Give people the support both online and through coaching to create new health habits that reduce risk over time. So that's what we've been doing, and some of our customers are in 20 different countries, and we have coaches in those countries, and we have platforms that can scale at a global rate. And it's incredible because no matter where people are in the world, they're struggling with different challenges, but they also have that human drive to improve themselves, and they just need that opportunity. Yeah.
So you're a few years into your journey as an entrepreneur and really building this company. What are some of the things that you've learned so far along this journey? Especially that would be helpful to other entrepreneurs that are considering coming into digital health, that may be building their business today in this sector.
Yeah, I think particularly in digital health, it's an important mantra in my mind to always build for the end user and to always keep the end goal of whatever it is, whether it's in our case helping people change behavior and creating a product that actually leads to that. It could be compliance with medication. It could be going back and seeing your doctor. But I think oftentimes I see entrepreneurs, and we are constantly tempted to take the shortcut. What is the buyer going to want us to do right away?
In terms of your product development, in terms of your business strategy, or
product development. So in our just as an example, and I think this applies to different situations, as a company, we're entering a space that is obsessed with rewards, right? Paying employees to participate in these wellness programs. The buyers in the middle market really want that. And for us, knowing public health in our background, we know that actually undermines people's drive to actually do things for personal reasons. So we, in many cases, stood our ground and lost contracts in the middle market. But because ultimately what we're doing is best for the end user, the employee, the buyers that cared because they recognize behavior change is the only thing that matters, we're the Fortune 500. So now we have these incredibly large contracts. It's extremely lucrative for us as a company. And we could have taken the shortcut and gone the easy way. And I think that applies to a lot of different medical devices, compliance issues, and hospital issues as well, right? You don't want to sort of say, okay, we had a call with 3 hospitals and they all said they want this. Let's build that. As opposed to, let me talk to the experts who are actually working on the ground. What do patients respond to and what do they not? Because in the end, your product will win out if it serves the patient or the employee in our case.
And what have you learned from the corporate wellness departments? What have you learned about the process of selling to them? How have things changed over the last couple of years to where the market is today?
Yeah, I mean, in our space, I think, and we call it the doc.
You're going into Fortune 500. Is it the head of HR? Is it the...
Yeah, it's the head of benefits, with a really large companies, it's the chief medical officer.
Okay.
And so the way to reach those folks are much more field sales and a lot of handshaking. And a lot of trust building. In corporate wellness, we call it the Dr. Phil effect, where everybody has the opinion that this is the miracle diet and this is the miracle drug and this is going to fix everything. Whereas I think, particularly in the Fortune 500, they've been lied to so many times by vendors and by miracle products that you have to be very genuine and honest about the difficulty of changing behavior.
And how do you do that? By showing data, outcomes,
So we
results?
absolutely use results, and being able to demonstrate and give references and say, hey, we did this study with this customer and this customer and this customer. Here's their phone number. Here's their credentials. Give them a call. But beyond that, let me explain to you that though the other vendors that you're talking to right now are telling you that, look at our first week of engagement rate, I'm going to tell you right now, we have lower engagement in week 1, but in week 12, we have triple the number of people that are sticking to that health habit. So I'm not going to come in here and tell you what you want to hear. I'm going to tell you what we think is valuable to your end goal. And they respect that. And I think it's also, there's a modicum of humility that you should bring to these sales processes. It's funny because in a lot of other markets, aggressive sales tactics are very strong, right? It's like, hey, we're better than these guys exactly because of this, and we're going to undercut on price, and we're going to be aggressive in every regard. And it works. In healthcare, there's a lot more trust because you're dealing with real people. And you're dealing with life or death in some cases. So
building trust.
Yeah, it's very
being
important.
Authentic. Thinking about the long term.
Yeah, and if anybody's going into the employer health space, the number one thing is the cold call sales efforts are not as effective as in other markets because HR and benefits people are inundated right now with offerings. And so thinking about more creative ways to meet them in person, get an introduction. I kind of think of it like meeting investors, right? Mm-hmm. The cold email just doesn't work, right? You've got to find a trustworthy way to get, and it all does. It comes back to trust, right? So because they're so cagey as a buyer, you've got, and I think that's applicable to hospitals now that digital health has become a more mature market, though it's still growing.
Are you noticing a definite change where there are more buyers, there's more, people in the market are willing to take action, to buy, to become a customer, to move beyond the pilot, so to speak?
Definitely in our case, the shift from the quote-unquote pilot to the full-scale paid was very effective. And I think it all comes down to data, right? If within the first 2 months you can demonstrate that your small-scale project was blowing away the numbers they've seen before, and part of this is good contracting, to be honest, then it's like, okay, we're at that point of decision. Do you want to scale this up? And so if you contract it right and you demonstrate proof points early on, the conversion from a pilot to a full scale is absolutely there. Mm-hmm. Yeah. It is a structure thing that I think entrepreneurs should think a lot about. We did.
In terms of the contract and how you structure
it, how you set the expectations up front of the relationship and what the purpose of that quote unquote pilot is. Oftentimes as an entrepreneur, you're so eager to get that logo, right? I got that big, I got Cleveland Clinic, right? But if you don't present a mature point of view, which is, now let's all talk about why we're doing this, because ultimately we're trying to address this problem, and this is a solution that could have this kind of impact on your organization. And so if we demonstrate success to this degree, then let's just agree that this is going to convert. And if you set that stage first, then there's a lot less rockiness when you're trying to transition from the pilot to the full.
How important has it been for you as an entrepreneur to be surrounded by an ecosystem of other entrepreneurs, other healthcare transformers, other folks experiencing the same challenges as you have been along your journey of building?
Yeah, it's both inspiring but practical. I mean, this morning I emailed 4 different CEOs, all healthcare transformers, to just ask, do you have a commercial contracts person that knows HIPAA? And being able to quickly connect with people and have that community at a practical level is great. But also being able to see each other, and this is sort of the 6 p.m. cocktail where you're just like, man, this is hard.
Right.
This is really, really hard. And how's it going for you? It's also hard for me. Let's talk about that and connect at and in an honest space where that I think as an entrepreneur, you're constantly on, right?
Right.
And being able to have people to just be yourself with is invaluable.
That's tremendous. So paint a picture of the future. What are you most excited about? What's coming for LifeDojo? What does the future look like? I think we're in a really exciting point where we have enough demonstration in the Fortune 1000 market that people are starting to talk to one another, and they're saying, I can't believe we're getting this type of engagement rate and this type of behavior change rate at 6 months with 0 incentives, right? We're not paying employees at all. But because they get to choose their habit, they get to choose their coach, they get to choose their program, they choose their app, their wearable, they're designing their own wellness program. And so you see employees feel like, oh, this is a perk. Like I get a free personal trainer over the phone. It's great. So I think that word is spreading. And so obviously, some of the largest companies on the West Coast have signed on with us in the past 30 days. It's really exciting. Congratulations. So scale.
It's all about scale. And I think ultimately, we're data nerds, so we're watching, and it's like we're getting further and further with every client, and we really believe that our 90-day programs, the the stick with itness of our programs is going up and up every day. Someday I really think we're going to solve this habit change challenge, and then the possibilities are endless.
Well, tremendous. Last question. What do you personally do, or perhaps your team, to stay healthy?
Nice. Yeah, so we all have gym memberships, and the gym's right across the street. But to be honest, I have a treadmill at home. And
walking meetings, walking phone calls.
Yeah, we haven't gotten to that point yet. We do meet in the gym once in a while, but I have a treadmill at home, and this is a good behavior change tip right here. I only allow myself to watch my favorite Netflix show when I'm on the treadmill.
Cool.
So,
I like it.
So
nice
I made it.
hack there.
I have to do it. Yeah.
Well, congratulations on all your progress and success, and thanks for being such an important healthcare transformer in the ecosystem.
Thank you so much, Unity. Appreciate it.
Thank you. We'll see you soon.